Welcome to the deep dive. Today, we're getting into the thing really crucial for hospitals, strategic quality planning.
It's a big one.
Yeah, and we've pulled together quite a bit for you. Articles, info from accreditation groups, insights from consultants, even a healthcare quality podcast.
A good mix to work from.
Right. Our mission here, to really break down what strategic quality planning is, why it matters so much for hospitals, and, the basic steps involved.
We'll touch on the benefits, too, and who the main players are in this space.
Exactly. So let's dive right in. When we say strategic quality planning in a hospital setting, what are we actually talking about?
Think of it like a detailed roadmap. But it's not just about the destination. It's about improving the whole journey, which is patient care.
Right. Improving the journey.
Yeah, it's a structured process hospitals use to figure out their quality goals and then, crucially, link those goals to their overall strategic plan.
So it's not just a separate quality project.
Not at all. It's a long-term view. It's about embedding quality improvement deep into the organization's culture, into how it operates day to day.
Makes sense. It's about building it in, not bolting it on.
Precisely. Strategic quality planning forces you to ask, okay, what are our quality goals? How are we actually going to measure if we're getting better? What resources do we need? People, money, tech, and maybe most importantly, how do we make sure improvements stick around?
So it's proactive, looking ahead, rather than just fixing problems as they pop up.
Exactly. It's about designing quality in from the start.
Got it. But hospitals are incredibly busy places. Why is taking this kind of long-term strategic approach so vital? What's the real payoff?
Well, the biggest win, hands down, is for patients.
Okay.
Strategic quality planning really puts their needs right at the center. It makes sure everything the hospital does is geared towards improving outcomes, making care safer, and giving patients a better experience. That's the core.
And hospitals are so complex, aren't there? So many moving parts. Does this help manage that?
Absolutely. It brings consistency and reliability. You've got different departments, tons of different procedures.
Right.
A strategic plan helps set standards so patients get consistent, high-quality care no matter which part of the hospital they're in or who's looking after them.
Okay, that consistency seems key. And what about resources? Budgets are always tight.
That's another huge one. Resource allocation. By clearly identifying where improvement is needed most, leaders can make smarter decisions about where to put their limited resources, staff time, equipment budgets, training funds to get the biggest quality bang for their buck. It's about investing wisely.
And then there's all the red tape, regulations, accreditation.
Yep. Compliance and accreditation are definitely easier to manage with a solid quality plan.
How so?
It gives you a framework. It helps you meet all those regulatory demands and successfully navigate accreditation, whether it's, say, NABH here in India or JCI internationally.
So it's not just about passing the test.
No, it's about embedding those standards into your daily work. It builds quality in.
You also mentioned making improvements last. How does planning help with that?
That's sustainability. Quality efforts can sometimes feel like short-term projects that just fade away.
Yeah, I've seen that happen.
A strategic plan helps integrate those improvements into the hospital's culture, making them the new normal, the standard way things are done. It aims for lasting change.
So fundamentally, it's about setting that long-term vision for being excellent and then mapping out how to get there, step by step.
Exactly. Always focused on better patient care and running things more efficiently.
It involves really understanding what patients need, what staff need, predicting future bumps in the road.
And developing plans to close those gaps, yeah. Continuously improving.
Okay, so we get the what and the why. It's pretty compelling. Let's shift to the how. If a hospital wants to create one of these plans, what are the key steps?
Well, first things first, you have to assess the current state. You need to know where you're starting from before you can plan where you're going.
Makes sense. How do they do that? Just, look around.
A bit more structure than that, usually. A SWOT analysis is really common.
Right. Strengths, weaknesses, opportunities, threats.
Exactly. That helps look internally and externally. But also, critically, they need to dig into their data.
What kind of data?
Things like quality metrics, patient satisfaction scores, feedback forms, clinical outcome data, basically anything that shows performance and highlights where the gaps are.
Okay, so get a really clear picture of today. Then what?
Then you need to define clear quality objectives. And the trick here is making them smart.
Smart. Specific, measurable, achievable, relevant, time-bound. I remember that one.
That's the one. It just makes the goals concrete and focused. avoids vague wishes.
Can you give an example, like a hospital wanting to improve safety?
Sure, so instead of just improve patient safety, which is too broad,
Right.
a smart objective might be reduce patient falls resulting in injury on the orthopedic ward by 15% within 12 months. See? It's specific, measurable, seems achievable, definitely relevant, and has a deadline.
Yeah, that's much clearer. You know exactly what you're aiming for. Okay, smart objectives are set. Next.
Now you develop the roadmap for implementation. This is the nuts and bolts, the action plan.
What goes into that roadmap?
It outlines the specific steps needed for each objective. Who's responsible for what resources, staff time, budget are required, how you'll track progress to your KPIs or key performance indicators, and of course, realistic timelines.
Sounds like this can't be done in a silo. It needs lots of people involved.
Absolutely crucial. Engaging stakeholders is next, and that means everyone.
Doctors, nurses.
Yep, clinical staff, definitely. But also admin staff, management, HR, IT, finance, and very importantly, patients and their families. Getting their feedback is vital.
How do you involve patients? Surveys, focus groups.
Both, yeah. Surveys, feedback forms, patient advisory councils, different ways to capture their perspective. It makes the plan much stronger and more relevant.
Okay, roadmap built, stakeholders engaged, time to launch.
Pretty much. Next is implementation, putting that plan into action across the hospital.
Which probably requires some good management.
Oh, for sure. Effective project management, really clear communication between departments, and strong leadership to keep things moving and keep everyone focused on those shared goals.
And I'm guessing it doesn't stop there. You launch the plan and hope for the best.
Definitely not. Strategic planning is a cycle, remember? The final, ongoing step is to monitor progress and adjust.
Ah, the continuous improvement loop.
Exactly. You have to track those KPIs regularly, see what's working, what isn't, are you hitting your targets, and be ready to adapt the plan based on the results. Maybe a strategy isn't working, maybe resources need shifting, maybe even the objectives need tweaking.
So it's alive, it evolves. Assessment, planning, action, checking, adjusting, repeat.
That's the essence of it.
Are there specific tools hospitals lean on to help manage all this?
Yes, several really useful ones. Data analytics and dashboards are indispensable today.
For tracking those KPIs in real time.
Exactly. They give you that instant visibility into performance, show trends, flag problems early. Visualizing the data makes a big difference.
I can imagine. What else?
The balanced scorecard is another powerful tool. It helps make sure you're looking at quality from multiple angles.
Not just clinical outcomes.
Right. It balances clinical quality with financial performance, the patient perspective, and the hospital's ability to learn and grow. It translates those big strategic goals into measurable targets across these different areas.
Okay. Keeps things balanced. We mentioned SWOT earlier for assessment.
Yep, and it's useful to revisit periodically.
Yeah.
And then there's root cause analysis, or RCA. Super important.
For digging into problems when they happen.
Precisely. Instead of just fixing the symptom, RCA helps you find the underlying system issue that caused the problem, asking why multiple times.
To get to the real root of it.
Yeah. Fixing those root causes is how you make lasting improvements, not just temporary patches.
Okay, that gives us a really good handle on the how. Let's zoom out a bit. We talked about accreditation being a driver. Can you tell us more about the big players setting quality standards, maybe globally first?
Sure. Globally, a major name you'll hear is the Joint Commission International, JCI. They've been around for over 20 years, widely seen as a leader in healthcare quality and patient safety worldwide.
And their goal?
Their mission is pretty clear: enable and affirm the highest standards of care and safety for everyone.
They work everywhere, basically.
Pretty much. They partner with hospitals and health systems in over 70 countries: Asia, Europe, Middle East, Africa, Latin America. It's a huge network. They've accredited or certified over 1,000 programs, drawing on expertise from hundreds of global experts.
Wow. Is it just hospital accreditation they offer?
No, it's broader now. They have various accreditation programs, sure, but also certifications for specific clinical programs like stroke care or cancer care. And they're moving into newer areas too, like healthcare sustainability certification and telehealth certification.
And they set the standards themselves?
Yes, they develop rigorous international standards and also specific international patient safety goals that are very influential globally.
Getting JCI accredited must be a huge undertaking. What do hospitals say they get out of it beyond the badge?
Yeah, we looked at some feedback. For example, Hong Kong Adventist hospitals mentioned it really helped build teamwork and communication. Burjeel Farha Hospital talked about gaining a competitive edge and more community trust, plus better risk management.
Interesting. Better teamwork, more trust.
Right. Emirates Specialty Hospital felt it really boosted patient confidence. And Corniche Hospital, which has been accredited for a while, sees it as proof of their ongoing commitment to top international standards. So it seemed to drive real internal change and external validation.
It sounds like a powerful framework, and they're looking ahead too.
They are. They have a big event, Unify 2025, coming up in D.C., focused on tackling major healthcare challenges together.
So JCI is a big force globally. What about closer to home here in India?
In India, the key body is NABH, the National Accreditation Board for Hospitals and Healthcare Providers.
Okay. Part of the Quality Council of India.
Exactly. NABH is specifically set up to run accreditation programs tailored for healthcare organizations within India.
So JCI is global benchmarks. NABH is focused on the Indian context.
That's a good way to put it. NABH aims to set benchmarks for quality improvement within the Indian healthcare industry. It has backing from industry, consumers, and government, but operates autonomously.
Got it. Are there organizations that kind of bridge these different national and global efforts, like a coordinating body?
Yes, there's iSquad, the International Society for Quality in Healthcare. They're a nonprofit, member-based group that's been promoting healthcare quality improvement globally for over 30 years.
And how do they do that? What's their role?
Their approach is multifaceted. They focus on education, sharing knowledge through publications and events, offering external evaluation services, supporting health systems, and basically connecting quality improvement professionals worldwide.
So building a global community around quality.
Pretty much. Their network covers over 70 countries on 6 continents. They run major international conferences. There's one in Sao Paulo in 2025 on inclusive health systems and Dublin in 2026. They also publish respected journals and papers on patient safety.
So there's definitely a strong ecosystem out there promoting quality. Now, navigating all this, the standards, the planning, the accreditation can be tough for hospitals. Do they often bring in outside help? Like consultants?
Oh, absolutely. Consultants play a significant role. We saw an example, Supreme Medic Consultancy Private Limited. They position themselves as partners for hospital owners.
Helping them through the whole process.
Yeah, right from the beginning, planning a new hospital, designing it, getting it set up, all the way through to achieving accreditation like NABH or NABL for labs.
Do they work with all kinds of hospitals?
Seems like it. They mentioned supporting everything from nursing homes and diagnostic centers up to large multi-specialty hospitals.
And what kind of services do they offer specifically? Is it just accreditation prep?
No, it looks quite broad. Things like hospital design, helping recruit doctors and nurses, implementing the quality management systems needed for accreditation, even ensuring equipment is properly calibrated. Plus, general healthcare business consulting on operations and strategy.
Okay.
Interestingly, they also mentioned offering equity partnerships for healthcare investments, helping people turn healthcare ideas into actual businesses.
So they can be quite involved. Okay, we've talked a lot about accreditation driving this, but does strategic quality planning bring benefits even if a hospital isn't currently seeking accreditation? Are there other payoffs?
Yes, definitely. We looked at a systematic review that specifically studied the link between strategic planning and both service quality and profitability in healthcare.
Oh, interesting. Profitability, too. What did it find?
The findings were pretty strong. It showed a clear, positive link. Strategic planning enhances both service quality and the hospital's financial performance.
How does it do that?
A key finding was about involvement. When hospitals really engage their employees, doctors, nurses, and patients in the planning process, it leads to higher job satisfaction among staff, more commitment, which translates directly into better service quality. And engaging patients leads to greater loyalty.
That makes sense. People support what they help create.
Exactly. The review also highlighted that good planning leads to more effective use of resources, less waste, better allocation, and fosters a culture of continuous learning. Both of those contribute directly to improved profitability.
So it's not just about feeling good, it impacts the bottom line.
Right. Consistently, studies linked strategic planning to higher patient satisfaction scores. Better operational efficiency, things just run smoother, and improved cost effectiveness.
It sounds like a win-win-win. Better care, happier staff, healthier finances.
That's the idea. The review also mentioned that strategic planning is a good foundation for other big initiatives, like digital transformation or implementing lean methods to cut waste.
So it helps with those broader changes, too.
Yeah, it provides the structure and alignment needed for those to succeed. It's also connected to better HR practices and overall organizational sustainability. The big takeaway was that a comprehensive strategic plan one that involves everyone, promotes learning, uses tech smartly, and thinks about people and long-term viability really drives both quality and financial success.
It really does paint a picture of strategic quality planning as more than just a checklist item. It's like fundamental business strategy for a hospital.
Absolutely. It's about running the organization effectively, sustainably, and always with an eye on providing the best possible care.
Okay, so let's try and tie this all together. What we're saying is strategic quality planning in hospitals is fundamentally about connecting those everyday quality improvement activities
To the big picture goals of the entire organization.
Yeah, it's structured, it's long-term, and it's vital for focusing on patients, ensuring care is consistent and reliable.
Using resources smartly, meeting those regulatory and accreditation demands.
And crucially, making sure improvements actually last.
Right. And the how involves that cycle. Assess where you are, set clear, smart goals, map out the actions, get everyone involved.
Implement the plan effectively, and then keep monitoring, keep adjusting, that continuous loop.
Exactly. And bodies like JCI and NABH provide those external standards and validation, while consultants can offer support along the way.
Ultimately, it really just sounds like a deep-seated commitment to always getting better, a culture of continuous improvement.
That's it in a nutshell. Excellence is an ongoing journey.
So here's something to leave you thinking about. We've seen how tightly quality, patient safety, and financial health are linked. So the question is, how can hospitals best use strategic planning, not just as a tool to get accredited, but as a core driver of real long-term value and positive impact for the communities they serve?
That's the key question, isn't it? Moving beyond compliance to true strategic advantage.
Definitely food for thought. Thanks for joining us for this deep dive.